Hi, my name's Iris Zink, and I'm doing an FAQ for the RAP organization, Rheumatology for Advanced Practice Providers. Today, they have asked me a question, and so here is the question. Are you ready? How can clinicians best approach talking to patients with psoriatic arthritis about weight management? So I have a sort of a strange approach to this. The very first patient visit at my office, I give the patients what's called a how to be healthy sheet that I developed that is a list of anti-inflammatory foods for muscle pain, a list of anti-inflammatory foods for joint pain. And we talk about absolutely no pop. We talk about avoiding foods that are nitrate laden. We talk about avoiding foods that have NutraSweet in them because that makes pain thresholds higher. And I tell the patients, every single patient gets this new patient, information. So we started on the very first visit that the patients know that I'm going to be talking about being healthy and diet and how the diet plays part of the healthy lifestyle, healthy life, healthy with living with rheumatoid arthritis or psoriatic arthritis. So I think I lay that ground, but I have patients that I've been taking care of for 26 years because I've been in rheumatology for 26 years. My husband and I opened the clinic in 2016. So we have the Medicaid clinic now where we serve the underserved in East Lansing, Michigan. We also have a location in Okemos. We're opening another clinic in West Michigan next year. So we really truly serve the underserved. 50% of our population is Medicaid. And so that presents more challenges. I do have patients that I've been seeing for a long time. If I'm noticing that their weight is going up, I will say, so what's going on with your weight? Are you on any particular diet? Or how are you eating fruits and vegetables? I ask that at every single visit. Are you eating plenty of fruits and vegetables? Because that's a way to approach it. The other way to approach it for me that I found very successful is that, we're doing lab work anyway. In rheumatology, we love our blood work. So I talk to the patients, has your primary care talked to you about any one of those GLP-1 medications? Or a lot of them are bringing it up to me. Can you get me on one of those P1 medications? Or how do I get on one of those GLP-1 medications? Or people know that I'm very holistic in my approach. And so what do you think about those GLP-1 medications? Are those safe? What is your opinion about that? And so we do have conversations about, most of the studies show that people who are on GLP-1 medications, their psoriatic arthritis disease activity is significantly improved. All the disease activity, rheumatoid arthritis disease activity is significantly improved as well. So all the spondyloarthritis disease activity gets better as people lose weight. So I use that as a touch point as your primary care offer that to you. When was the last time you were checked for diabetes if you haven't been? Should we do a hemoglobin A1C while you're here today getting lab work anyway so that we can circle back? And then on the bottom of my note that I faxed to the primary care physician after we're done, it has a whole paragraph about patients with psoriatic arthritis have double the risk of cardiovascular disease. One way to modify that risk is improved disease activity. And current studies show that patients who are on GLP-1 medications have improved disease activities. So, I have this on the note sent to the primary care as kind of a little reminder that they need to discuss that with the patients too. It's hard for some of my patients to get into primary care because they're Medicaid based. I have a lot of Native American population as well. And we do send them back to the free clinic. It's hard to get on medication sometimes for the GLP-1, but that's where you have to do the disease activity counseling and food. Are you eating fruits and vegetables? Are you getting food that's highly processed? Or are you trying to get food that is just clean, Whole30 diet, something like that? So we do have these conversations, but we do take a BMI on every single patient. I'm sure that you're all taking BMIs on all of your patients. We know that patients who have a BMI greater than 30 have double the risk from going to psoriasis to psoriatic arthritis. We know they have higher disease activity that's harder to control. So I think you can bring it up with the BMI, as part of the vital signs. You can ask the patients a question, can we talk about your weight? I don't traditionally do that because I have such a long-standing relationship with my patients. I'm like, so what's going on with your weight? What's going on with your body? Are you having more depression? Are you exercising every day or at least 4 days a week? So it's bringing those things up and then asking, is it okay if we talk about weight management, or have you talked to your primary care about a GLP-1 medication, or are you interested in that? So those are some of the tips and tricks that I use in my clinic. I'm sure the other providers that are in the clinic do it differently, but the most important thing is that we do it, that we have the conversation, that we care enough about our patients to have that hard conversation with them, because we know that they'll be healthier if we do have that conversation with them. We know that their life expectancy will be better if they are of a normal BMI. So it's very important that if we care enough about our patients, to have that conversation in whatever way is comfortable for you. Thank you so much for joining in and listening to my FAQ with WRAP. If you want more content, please look at the WRAP app or the WRAP website for more interesting content. And thank you so much for joining in today. I really appreciate you.